Hi, I'm Dr. Joanie Winstead, and today we're going to be talking about the importance of pH. And I'm going to give credit where credit is due. I got this information from Dr. Michael L. Johnson, who started the neurometabolic group that I, along with 400 plus other doctors, are members of. So back to our pH. Your body is alkaline by design and acidic by function. Your normal body pH is 6.4 to 7.0. Ideally, you should start your day with a body pH of 6.9 to 7. As the day progresses, the body accumulates waste byproducts, and the pH should slightly decrease from 6.4 to 6.6 until the body discharges the waste through the liver, kidneys, and the lymphatic system. Now, I will tell this, I have found that many chronic illnesses usually begin with the patient being acidic. In other words, they suffer from low pH. And in the beginning, these patients feel fine, but since their pH is acidic, it is a slow spiral downward towards illness or ill health. You add the fact that they are not creating methyl groups because of a low HCl in their stomach, and it's a recipe for disaster. So we're going to talk a little bit about what the pH does. Number one, it's buffering the blood. When you're acidic, your body leaches minerals out of your bone to buffer your blood. Now this is not good because you are headed towards osteopenia and or osteoporosis. The other thing is heavy metal toxicity. When you're acidic, you are at a greater risk for heavy metal toxicity, which in turn causes a downward spiral of free radicals. Calcium lines the brush border cells of the gut to prevent absorption of heavy metals. And when you're acidic, you have lower levels of available calcium, magnesium, and other trace minerals like selenium and zinc. In addition, lower levels of essential minerals allow for the creation of free radicals in the body. The mitochondria are the powerhouses of a human cell, and free radicals damage the mitochondrion. The mitochondrial DNA is 10 times more sensitive to free radical damage. But the good news is that this extreme vulnerability of mitochondrial DNA can be protected by targeted nutraceutical agents. How does those things work? ATP boosting, and they quench every free known radical in living tissue. It helps to regenerate vital antioxidants like CoQ10, glutathione, NADH, vitamin C, and vitamin E. And we have those nutraceuticals available to us. Now we're going to talk a little bit about the importance of the pH and the thyroid gland. Many doctors, physicians, chiropractors, naturopaths, they're addressing thyroid issues, but they are not checking the patient's pH level. Now, in my opinion, this is a huge mistake, and here's why. The minerals that create an alkaline environment in the body, 6.4 to 7.0, are calcium, magnesium, and other trace minerals. They're very important to the thyroid patient, because every cell, and I mean every cell in the body, has thyroid hormone receptors. And these cells need to accept T3 to survive. Well, they cannot accept the T3 without those minerals. So if a patient has low pH, well then guess what? They are low in these essential minerals and they are unable to accept T3. Do you wonder why some thyroid patients are not responding? This could be the reason. Now, T4 to T3 conversion is dependent on zinc, and low levels of selenium will cause inactivity of T3. Should patients be taking a handful of zinc and selenium? No, but you need to get the body pH up and increase the stomach acid so you can absorb the correct amount of zinc and selenium from your food. Now, zinc is mainly found in beef, lamb, veal, crab, shrimp, scallops, turkey, pumpkin, sesame, and squash seeds, oysters, peanuts, and yogurts. Selenium is mainly found in tuna, cod, halibut, sardines, shrimp, salmon, beef, turkey, and lamb. Now, pH in lowering the immune response. Being acidic creates a welcoming environment for viruses and bacteria to flourish. Therefore, pH is a huge player in the immunity. And I strongly feel that part of the reason there's an autoimmune epidemic in the United States is the chronic low pH levels. If you've noticed that you are more susceptible to colds and flus, this could be one of the reasons why. Well, you want to know, how do you check your pH level? Well, it's simple. You get some pH test strips and you check your first morning urine after 5 a.m. You can get these strips at any health food store. But please note, one urine test is not sufficient. You need to check your first morning pH for at least a week and preferably 2 weeks to see a consistent pattern. Now we're going to talk a little bit about the parathyroid. The problem is that everyone and their uncle are addressing thyroid glands with their patient population, but no one is addressing the parathyroid issue. The thyroid and the parathyroid work hand in hand. The major function of the parathyroid gland is to maintain the body's calcium level. It buffers the blood. So everyone is addressing the thyroid without addressing the parathyroid, which is kind of like exercising to lose weight but never changing your diet. Okay? And yes, lab-wise, you could check the parathyroid hormone, but if the calcium, phosphorus, magnesium, and or vitamin D levels are off, there's a great chance that the parathyroid is not functioning and it needs to be addressed. If your parathyroid isn't working, well, guess what? Your blood will not be buffered and you will be acidic. In addition, the parathyroid is the most sensitive organ of the body for heavy metal toxins. And we have supplements that help this. Low pH and chronic pain. Well, people that suffer from chronic pain, unrelenting pain, suffer from low pH. If the first morning urine pH is consistently lower than 6.0, the patient is in chronic pain throughout the day. Low pH and cancer. Studies have shown that cancer loves two things: an anaerobic, which is a lack of oxygen, and an acidic environment. Increasing your pH will help prevent cancer. Well, how do you correct low pH? Well, you drink plenty of water, good water, distilled or filtered water. And basically the way you do it is you get your body weight, subtract it by, divide it by 2, and you drink that many ounces. You also change your diet. More veggies, eliminate junk food, and the white death. White flour, white sugar, white salt. Now it should be noted that if a patient suffers with a chronic infection, you have H. pylori, parasites, liver flukes, you won't increase your pH until these infections are addressed. So, first thing, urine pH is over 7.0. Well, your body is in severe alkalosis, and the minute we supplement the patient to get with a pH above 7.0, your pH is going to crash to 4.5 or lower. Seen it happen, so if you're one of these people, it's going to happen, and just know that. Again, body pH is very easy to test with a box of pH test strips. Follow the directions. Make sure it's the first urine after 5 a.m. That's tested. And the saliva pH is not as accurate because it has not gone through the body's metabolism. Now finally, I strongly recommend that you do not drink alkaline water, as it will alkalize your stomach and not your body. You want the stomach acidic, not alkaline, so it can digest your food and create methyl groups. Now I have patients that's drank it before for years, and when we checked their first morning urine pH, they were acidic. You've depleted your body of methyl groups due to the lack of stomach acid, and they were headed down the road to cancer and/or the chronic conditions. So if you're interested in any more information on the pH, or if you check yourself and you'd like some information on what we do to bring pH up, because we have specific nutritional supplements that are excipient free that we use that works great. But if you're interested, email me at drjoaniewinstead@gmail.com, and we will get you information and head you into the right direction. Thank you.